Hi everyone, thank you very much for joining. Today we're going to chat around, following on from our female athlete workshop, we'll chat around a little bit around the menstrual cycle. So I've kindly got Scott here joining me, who works at Leeds Beckett, PhD student. Thank you very much, Scott, for joining. I really appreciate it. If you want to just give a short intro about yourself, that'd be great.
Yeah, thank you. Yeah, no, my pleasure. Always good to get some research findings out there and talk about these things and everything. So yeah, so I'm Scott. I'm a now third-year PhD student at Leeds Beckett. So I've been looking at muscle and tendon function in female athletes as a sort of primary sort of overarching goal of the PhD. But then also a major part of that is we've been doing a menstrual cycle study as well alongside. Sort of one of the major studies of the PhD to just understand what's happening to particularly muscle and tendon function throughout the cycle. Is that something that's quite sort of unknown previously in the research, and then sort of using that data then hopefully then inform some training practices and things like that to sort of better inform coaches and athletes themselves on how they may be training sort of with and around their menstrual cycle and things like that. So just it's really almost like quite exploratory and just trying to find out what on earth is going on, really, because a lot of this stuff hasn't been studied very well before. So it's a good place to be researching at the moment.
No, it sounds great, and then especially the rise of women's sport is something that really should be considered as a coach, around differences in menstrual cycles and what to be aware of as a coach. So I really look forward to that research that's coming out soon. So firstly, just a bit of an introduction and background. So firstly, can you explain what is the menstrual cycle, or just aspects based around the menstrual cycle as a whole?
Yeah, sure. So I'll keep this as much as I can sort of relevant for sporting purposes and things like that, and things again that coaches might want to know. But yeah, the menstrual cycle is a basic physiological function. It's common to most women at some point in their lifetime, and there's a whole load of things that are going on every cycle for a woman who's experiencing a normal menstrual cycle. In terms of what sort of we've been interested from, a potentially a sports performance training perspective, things like that, it's particularly the change in hormones that we're interested in. So two of the major hormones that we're interested in looking at are estrogen and progesterone. So throughout the cycle, you could sort of break the cycle down into two primary sort of phases. So you've got the follicular phase and then the luteal phase, with those two separated in the middle, usually in the middle or so by ovulation. So in the follicular phase, you've basically got estrogen is going to sort of start off quite low. Both hormones start quite low. Then estrogen is going to spike upwards, and that's going to get quite high. And then just before ovulation, it peaks. Then that's going to drop off. And then throughout the luteal phase, for the remainder of the last half of the cycle, both estrogen and progesterone hormone concentrations are quite high. Now, the reason why those are interesting is because they are, estrogen especially, it is an anabolic steroid hormone. Like, it sounds kind of strange to think about it in that way, but it is an anabolic steroid hormone. So it does have, although it's got wide-ranging impacts on loads of different tissues within the body, and it does have impact on muscle tissue and tendon ligament tissue as well. So what we've been interested to see is, as these hormones change, so as estrogen rises and falls, as progesterone does as well, because progesterone tends to have anti-estrogenic effects, as they rise and fall, what impact does that then have on things like muscle strength, stretch shortening, cycle performance, tendon function, ligament laxity, things like that? So these are the things that we're quite interested to find out. So it's worth mentioning at this point as well, when we just talk about the menstrual cycle, that it is much more than changes in hormones. Of course, it is there in the most basic sense to promote pregnancy and have a woman fall pregnant. That is the main reason for a menstrual cycle, but there is so much more to it than that. So we can talk a little bit later about considerations to make when it comes to talking about advice around the menstrual cycle and things like that. There's a whole lot going on, but particularly for muscles and things like that, we can be interested in how that can then affect their function throughout different phases of the cycle.
Yeah, I'm sure you could talk for hours on the menstrual cycle and different complexes of it.
Definitely, yeah.
So what ages would you generally see onset of girls maybe getting a menstrual cycle?
Yeah, so average age is around about 12. You'll start to see most girls get their periods then. Now, that does vary a lot. Now, one of the key things which I'll keep harping on about today, is like there's so much variability and stuff. So whether that's the start of a cycle or whether that's throughout the person's cycle or cycle to cycle, differences between people, there's a lot of variability. But typically around about age 12, girls will start to get their first periods. Now, that's usually called menarche, if you may have come across that word before. That's sort of the onset of the menstrual cycle. They're called menarche. Now, those first few cycles, maybe in the first few months, few years or so, that often girls will have their periods, but they won't be quite regular by that point. They do sometimes take some time to get to have what we would call sort of a regular normal menstrual cycle. So the things that we're talking about for particularly those youth athletes who are sort of like early mid-teens or something like that, there will be quite a bit of variability in who's experiencing what at that given time, but usually around about 12 or so is when they may just begin to start, and then that'll sort of build up over the next few years into a sort of normal and quite generally reasonably consistent menstrual cycle from there.
Well, like I said, there's a lot of variability in that, but you mentioned on a normal cycle, what sort of time length would the cycle be, just to be aware of as a coach?
Yeah, so again, you'll see a lot of a lot of the things will say a 28-day cycle, and that would be a normal cycle length would be 28 days. Now, really, the guidance says a normal cycle, or what would be classified as a normal menstrual cycle, would be anywhere from 21 to 35 days. So typically that would be then, say athletes having 10 periods within a year is what you'd probably normally say is a normal menstrual cycle. Then if it's somewhere between 21 and 35 days, again, there's lots of variability within that. So some people have consistently short cycles and their cycles may be 23 days long, whereas others may be closer to 35. So there is quite a lot of variability in there. But yeah, most women, again, most things are on a bell curve, aren't they? So most women tend to fall around about 28 days, but there's variability in there. And importantly as well, there is also variability in that within people as well. So you may have average 28-day cycles, but some may be 26, some may be 31, and the next one might be 30, then 28 and 28. So there is variability there, but it just depends on the person of how sort of consistent that is. But usually 28 days is the sort of average, if you will.
And then what common symptoms were you likely to see or likely to have females maybe expressing to you, or you might see as a coach, just to be aware of if someone is during their menstrual cycle or having a period or something?
Yeah, so so we talk about symptoms. We can also talk about timing of symptoms as well, because that's quite an important factor as well. So symptoms really can range from there are a number of things for the research that we're doing currently. We have a list of 18 different things, but within each box there's like 2 or 3 symptoms in each box. So we're talking like anywhere up to sort of like 50-ish symptoms or something like that could potentially be present. So very common ones are, well, where to start? So there's often physiological and psychological. Now, there's also quite intertwined these things as well, because obviously, again, these hormones are affecting the whole body. So this is a reason why you get a lot of these symptoms. Often you get things like back pain, pelvis pain, sort of hip pain. You get stomach pains as well, bloating, things like that as alongside that. So things happening sort of gastrointestinal wise. So again, bloating, sometimes sickness feelings, sometimes diarrhea, things like that, or just increased gas. Back pain and joint pain is quite common as well. So again, depending on what kind of athletes you work with, but at certain phases there may be particularly those back pains and either back or stomach cramps. Other things are things like, again, sort of dizziness, of unsteadiness. If you're working with sort of like skill-based sports, then that's something to bear in mind, is often like general sort of best word for it is almost like clumsiness. Sort of dizziness and clumsiness can come and go at certain points of the cycle, and therefore sort of skill and precision-based tasks can sort of suffer from that as well. And then beyond that, there's just the sort of, I suppose, more sort of cognitive ones of just mood changes. So whether that's poor mood, irritability, things like that. Sort of one of the things is just letting things get to you. So you're more irritable, you're more sort of reactive to things like that. So common symptoms, they're sort of a good sort of range. Again, they do vary person to person a lot, but when it comes to timing, there's quite most women will experience these symptoms towards the end of the cycle. So you may have heard of premenstrual syndrome, PMS. So essentially, that's the time point before the start of a new cycle. So we define the start of a cycle as the first day of a period. So when a person gets a period, that is then the start of their cycle. So usually the week before that, or the few days leading up to that, that's when symptoms tend to be their most severe or numerous. So what's happening there is both hormones have gone up nice and high, and they're starting to drop off. And as they drop off, a lot of changes then happen in the body, as the body's been used to these hormones being quite high for 10 days or so. And as they drop down, you tend to get quite a lot of symptoms there. So typically that's the time point where symptoms are most numerous and most severe. So those sort of few days before the period, and now also throughout those period days as well, symptoms tend to be reasonably high at that point as well. So those are definitely time points to watch out for. It's not to say you can't experience symptoms at other times of the cycle, but those are the by far the most commonly reported time points there.
Thank you. That's great. I think a lot of coaches and myself working with the females, you can relate to a lot of those things you might have seen through athletes, and from not knowing previously what's going on, you can start to put two and two together, what might have been going on with that athlete, where there might be different mood changes from session to session, for example, especially when you might only see them from week to week. Yeah, there might be different things that one player might come in different mood week to week, which is quite interesting to see. So you mentioned around performance wise first, especially around sporting performance, maybe around muscle strength and tendon stiffness and stuff, and so change around complex skills tasks as well might influence performance. Have you found any relationships around performance in different stages of the menstrual cycle?
So what we have found so far is, again, lots of variability. Again, like I said, it's a key factor. We find just lots of variability within and between people. Now, the theory goes that as these hormones change, so should then these properties again of things like muscle strength and things like that. So you would sort of expect in the first half of the cycle, sort of towards the middle of the cycle, as estrogen starts to increase, you may experience then potentially greater muscle strength. We do see this in some athletes. Some athletes are going to experience a greater increase of strength in that sort of towards the middle, and maybe throughout the rest of the cycle from there, with that early cycle time point not being quite so strong for them. Again, once estrogen gets up nice and high again, like I say, it's an anabolic steroid hormone. It's having a lot of effect on particularly like sort of neuroexcitatory mechanisms, allowing you to contract your muscles harder essentially. Now, I've seen that in sort of a handful, maybe a third to a half of participants tend to have slightly stronger performances throughout either the middle and towards the sort of 2/3 of the way through the cycle compared to early cycle time points for muscle strength. Now, again, the tests we're doing in the lab are quite sort of basic, like isometric, just contract as hard as you can and see what your muscle force output is. Basically, how that transfers over to more dynamic tasks is not quite fully looked into that yet, but we'll be investigating it further as we go through the rest of the data analysis. So strength, you may experience increases towards middle or later cycle. However, again, there is lots of variability there, and both between people, but also within people as well. So it's important to note that because we've studied 2 cycles back to back, that an athlete may experience quite a decent increase in strength throughout the middle of the cycle in one cycle, then in the next cycle they might not be quite as increased. Now, you may see the same general trends, but just different magnitudes of change, basically. But these are things which often the menstrual cycle is often talked about as quite like a negative aspect of, or it's going to impact your performance. You're going to perform worse, and you're going to have a negative effect of symptoms and having a period and things like that. But there are potential ways you can sort of maybe even train around it to sort of benefit from it. And if you're coming towards the mid-cycle time point, you might be feeling good from that, then try and take advantage of that sort of thing. If you're getting training in the gym, things like that, maybe you can push things a little bit harder through certain phases because you're going to be feeling good throughout those time points. As far as the results for things like tendon stiffness, now we've not studied ligament laxity, but there is a good amount of research that has done previously. That's showing again sort of middle cycle, particularly then also towards the later cycle as well, that those things may be decreased. So it may be that strength is increased, but estrogen tends to have sort of like I suppose what's the best word for it? Creates the tendency to be more compliant, and ligaments potentially be more compliant, so they're a little bit more lax, which then may be potentially a risk factor for tendon or ligament injury for there. So I suppose based on that theory, you would recommend at those sort of mid-cycle time points, heavy strength work, great, but stretch shortening cycle based work, lots of cutting, jumping maneuvers. Not to say not to do them, but maybe just be slightly more careful with them. For example, now those are all sort of the things you could theorize based on the theory, but the main thing you can really do is just have athletes track and see what happens, really, because everyone's going to experience their cycles differently. But if athletes can track cycle to cycle, they can track what's happening, they can know, okay, I've had lots of people on the study who've not really thought about these things before, and as they've come through the 2 cycles of study, they've been like, Joe, I never noticed, but I've always been really good on this around this time point, and I've never really thought about why. Or there's this time point where I felt really clumsy and just really sort of not quite with it when I'm trying to do things. But now I've realised it's the same time point every cycle. Now I'm actually tracking my cycles. So there are these time points which there may be performance changes, but the only way to find out really is just to track them. It's just to have athletes track and see what happens each cycle from cycle to cycle.
That's great. And again, I've had it in the gym where I've had athletes say that they feel like, oh, why am I lifting 20 kilograms heavier this week, or why am I running so much quicker today compared to another day? So yeah, getting them to track and getting them to be aware themselves is a great tool, I think, to encourage as a coach. And like you mentioned around, there could be psychological differences as well throughout that phase, rather than not just physical changes. So mood and motivation or confidence, I'm guessing, could vary across the stage, which can influence performance or how they learn and take cues and stuff.
Yeah, absolutely, and that's the thing. So we have collected this symptom data as part of the research. We've not analysed that yet, but it's going to be really interesting to see how much of any of these changes, how much are they due to symptoms and feelings and mood states, like you say, because it may be that physiologically your muscles aren't actually that much stronger, but you might just feel good one day. And this is where it ties into, we can sort of ask, are some of these changes that we see, are they specifically menstrual cycle changes, or are they just general variability that exists anyway? Because we all have good days and bad days in the gym and for training. Some days you've not had a good night's sleep and you've fallen out with your best friend, and then you come into the gym and you don't really have a very good session, whereas other days you might be feeling great. And although there are maybe cycle related changes, you just have to be sort of conscious of other things that may factor in as well. So it's easy to, especially for me as a researcher, it's all menstrual cycle based, but there are a lot of things that sort of go into that as well. But yeah, I think that's the main thing that coaches can do really, is just have their athletes track cycles and just try and note down patterns so you can track cycle lengths. We can talk about tracking cycles to track health and things a little bit as well afterwards, but have athletes track their cycles, note down their cycle lengths, so just from one period to another is essentially one full cycle, and just note down days they're feeling good, days they're feeling bad, symptoms, things like that. And then after a few cycles you'll be able to build the profile, and there may be patterns, there may not be, there may just be variability cycle to cycle that they can't really predict, or it may be again that some athletes, I'm generally feeling good around this time point, or actually I always have these certain symptoms at this time point, so I know to scale things back, for example. So just tracking and monitoring is the most powerful tool really that can be used in this situation, really.
That's great. And educate, like you mentioned, education and getting the females to learn themselves is a great tool to use and a great insight for them.
Yeah.
On the flip side, is there anything to be aware of from an injury point of view? Like you mentioned around changes in physical states and stuff. Anything around injuries that we need to be aware of, like you mentioned around cutting and landing, maybe not doing as much in certain phases?
Yeah. So as always with a lot of the sort of injury-based research, it's a lot of times it's quite sort of observational in nature, and we can sort of we can have these, what we would say, there are mechanisms where if tendon stiffness is decreased or ligament laxity is increased, then that's maybe a risk factor for injury, but it's something that's really difficult to study and sort of draw quite strong conclusions from. Just because you can have people injure themselves in order to carry out a study. But but it based on the theory again, there may be time points at mid-cycle in particular where estrogen's quite high, where there may be a slightly higher propensity for tendon and ligament-based injuries. But I get very that can easily, that kind of line of thinking can get quite sort of scaremongering away, be like, don't do jumping and landing and things like that in the middle of your cycle. Are you going to blow your ACL? Like it's really not as intense or severe as that. Things like that, and a lot of the times those type of injuries are due to either contact or just poor sort of, I suppose, technique, biomechanics, sort of posture, things like that. Anyway, which maybe there's a slight contribution from menstrual cycle changes, but there's a lot of other things to consider when if you have an ACL rupture. There's usually a lot of other things going on there beyond purely just cycle-based changes in ligament or tendon laxity, for example. As far as sort of ways to work around things is again just train as normal, train safely, make sure you have your, if you've been injured before, you're doing your rehab, make sure you do your rehab, things like that. Just any risk factors for injury that there may be already, like poor landing mechanics from jumps, for example. Those are things that should just be being worked on anyway. And because you can't really change what's happening within your menstrual cycle each cycle to cycle, it's not really necessarily something to worry about too much. Again, there may be athletes who are experiencing, I get quite a bit of joint pain around this time of the cycle. So is jumping and landing a lot of the time in that phase, is that going to be good for them? They're probably not going to enjoy it, do very well at it, things like that. Those are the sort of things you can sort of consider. But although the research may or may not say that there may be increased risk at certain phases, there's in ways not really much we can do about it, really. So it's just train smart and safe anyway, and just do your best from that perspective, really, I suppose.
Then you mentioned around the importance of tracking and for getting girls to track their own. Have you got any tips or advice as a coach or as a parent how to help or how to guide a player in terms of tracking their period or menstrual cycle?
Sure, yeah. So tracking is quite important because first of all, you can find out a lot about yourself and as an athlete and things like that from tracking. Now, I'd always tend to say that coaches advise athletes to track themselves as opposed to the coach asking for that information for themselves, because if you're gathering information from someone, you should be using that to some benefit. And obviously, every time you collect some data, especially quite personal and sensitive data like this, if you're collecting data, you should have some quite obvious benefit from that. You're not just collecting data for data's sake. And especially, if you're a male coach, especially collecting data from women on their cycles, quite personal information there. There's a lot of sort of risks to consider from taking information that you may especially not be doing a lot with. So I usually always advise, like say, ask athletes to track themselves, and then if they're open and they're fine to have that conversation with a coach, great. But if not, they'll at least got that information themselves. But from a health perspective, it's a good thing, as a normal menstrual cycle is a good sort of indicator of overall general sort of health. So this is particularly an issue in weight class sports or athletic sports, for example, or endurance sports, where athletes tend to lose their periods. They tend to what we call amenorrhea, where they don't have regular cycles. This is often due to low energy availability. So again, those weight class sports or endurance sports in particular, there's a lot of energy expenditure, or there's not enough energy intake relative to expenditure. And when you get that state of low energy availability, a common occurrence is that the athletes lose their period from there. So that's a sign, if an athlete is not having a regular period, that there may be some other sort of underlying condition or something like that to consider and take care of. Now, that's not to say if you don't have a normal menstrual cycle, you are not healthy, but it's definitely something you can sort of track in terms of a point of health, where if an athlete has either never gotten their period as they've gone through puberty and such, because again, they may be in low energy availability or something like that, then that's a point that then should maybe be looked at again from a medical professional. So if athletes aren't having regular periods, that's a conversation with the doctor to have. Again, but coaches can still tell them this information and say, look, if you've lost your periods, that's probably not a good thing. It's probably not a good marker of overall health. So therefore, speak to your doctor, sort of thing like that. So the only issue with that is some athletes are like, oh, great, I've lost my period. Great, I don't have to worry about it. It's fine. But that's not really a very good sort of positive sort of frame of mind to be in, really. But if you ask athletes to track, if they're having regular periods, that's generally a good sign. The overall health is there. If they have lost them or never got them in the first place, then I think that's definitely a signpost to a GP from there.
And then probably one on top of that is any tips around maybe the girls starting to get a bit older around contraception and stuff, and now that could affect menstrual cycle. Just as a coach, just to be aware of if you do come around that factor. Is there anything to be aware of there?
Yeah, so if you take hormonal contraceptives, now there's lots of different types of hormonal contraceptives. So you've got things like, most common type is the pill, so you'll take some form of pill, but there are things like injections, the implant, things like that as well, which will work as hormonal contraceptives. So what they basically do is, we use the pill as an example instead, because that's the most common one, is essentially you're ingesting hormones through the pill, which then downregulates the hormones that your body is producing, the endogenous hormones, by you're taking these exogenous hormones, we call them. So it downregulates the system. So essentially, you don't have a menstrual cycle anymore. You have a pill cycle instead. So the menstrual cycle just essentially doesn't happen because you're taking the pill, because you're ingesting these hormones, there's lots of signals in your body that basically say, oh, we don't need to produce any ourselves because this hormone's already quite high, and then that essentially stops the menstrual cycle from happening. Now, with hormonal contraceptive use, there are different things to consider. So the hormone levels, rather than changing in the way that they do with the menstrual cycle, typically most people use a monophasic oral contraceptive pill, which is basically just where you get the same amount of hormones every single day for 3 weeks. Then you have a week off, 3 weeks, a week off, 3 weeks, week off, like that. So instead of having these sort of phase-based changes, you're just having the same constant amount of sort of hormone ingestion each day for your pill-taking days. So there is less sort of fluctuation and change in hormones there. Now, that comes with sort of some different considerations now. There are side effects that you can get from hormonal contraceptive use. So rather than having menstrual cycle symptoms, you may have hormonal contraceptive side effects instead. Some women take hormonal contraceptives in order to sort of avoid or remove menstrual cycle symptoms. So particularly people who may have had some quite intense menstrual cycle based symptoms, they may have started or been advised by their doctor to try hormonal contraception, because that can then remove those symptoms from the menstrual cycle. But there are a lot of side effects associated with hormonal contraceptive use as well. So again, those will vary person to person, but the symptoms tend to be, the side effects tend to be quite similar to the symptoms. So you get, again, it's the same hormones that are affecting things. So you get sort of similar symptoms to the menstrual cycle, but for some people that may be a lot less, it may be a lot more. So it just depends person to person. But for those hormonal contraceptives, you're dealing with a different hormonal environment. So all the stuff we said on menstrual cycle essentially doesn't really count, essentially, because the hormonal profile of the woman will be very different depending on what type of hormonal contraception that they're using.
No, that's really good, and a lot of great information there for coaches to take in. And have you got anything just to summarize it up on, if you're going to recommend to a skills coach or technical coach who might be working grassroots level or a youth pathway level, just to take away from this in terms of how can they consider or bring into consideration around the menstrual cycle working females, just some tips or guidance?
Yeah, of course. Yeah. So as I said, the main thing I think is tracking and asking athletes to track and just become aware. So education for yourself, education for the athletes, and tracking cycles. So again, the best way to find out about how any given athlete's menstrual cycle or hormonal contraceptive use influences them is they just need to track and monitor and see what happens throughout their cycles, basically. You can use this data, really, again, it's good for health markers, just to check that, if someone is experiencing a normal menstrual cycle, they're not using any form of hormonal contraception, and they've got a normal menstrual cycle, it's generally a good indication of overall good health. If they have lost that, then that's maybe, again, something to explore with a medical professional. Now, tracking those cycles can be good. It can help athletes get a better understanding of themselves, which can be really beneficial for themselves, especially you can be quite frustrated as an athlete when you're having good days and bad days and you don't quite know why. You're like, why am I feeling rubbish today? Things like that. But through tracking cycles, you may be able to sort of understand why that may be, and it can be quite, in some ways, quite a relief for an athlete to understand that actually this is why I'm experiencing this way, and it's nothing. It's not because I'm lazy. It's because I've just experiencing these cycle-based symptoms, and that's why. And it can sort of be quite a sort of empowering knowledge to know about your own cycle and how that may be affecting you. I suppose just being aware that athletes also may not want to be super open and talk about this. Again, it's very sort of personal and sensitive information. So an athlete may just say they're not feeling good today, and that doesn't, as a coach, if you need to know whether that's menstrual cycle related or it's just how they're feeling, that's sort of a call you'd have to make. But just sort of take each athlete's experience, at face value, and what they're experiencing is what they're experiencing. It's good to have that sort of, if there is possible for an open dialogue between athlete and coach, that's really good. But again, not everyone's going to be sort of open to that. It just depends on the athlete. But just sort of trying to have an open dialogue if possible, understanding what changes and experiences athletes may be having at certain points as they're getting, and then continue on with their menstrual cycle, and just sort of being conscious of what may happen, but just sort of letting each athlete be in charge of their own reality and things like that. And if they're experiencing certain things, then that's what they're experiencing. So just being aware of that and sort of accepting that, I suppose, is the main thing.
No, thank you. I really appreciate your time, Scott, and some really great insights there and information to take in. I'm sure there's a lot more to come in terms of learnings and different outcomes as how we can help those female athletes around that cycle and things to consider. But I really appreciate your time.
Yeah, no, it's been a pleasure. Yeah, there's so much more I can say on all the topics, but I hope that's been a good helpful just overview of things to consider and sort of a good overview.
Thank you. And then if anyone does have any questions, then feel free to let me know and I'll pass them on to Scott. And anything in scenarios that you might see or any situation you might see, I'll pass over if you need any advice.